Hello friends, I am Dr. Rajeev Godbole. I am an adult heart lung surgeon and I would like to speak to you about certain common treatments that we offer patients. Speaking about bypass surgery, which is becoming quite common these days and has certain benefits which, if done in time, spare the patient a lot of pain and problems and return them back to normal life. Now, what is a bypass? A bypass is literally what it means. What we do is we take a blood vessel either from the leg or from inside the chest or the arm and create a new way for blood to get to the heart beyond the previous block. So, in essence, it's just like if you would have a highway bypassed. Now, we have a choice of vessels we used. In the old days, a lot of the operation was done with veins taken from the legs. Then came the arteries, which were taken from either the arm or from inside of the chest. Nowadays, in younger patients, we tend to do most of it with arteries. So, when do we do this? We do this when there are more than 2 or 3 blocks, or when the main blood vessels are involved and it's difficult or dangerous for an angioplasty to be done. In that situation, we carry out bypass surgery and then we send the patient home after a week. In between, what happens is the patient stays in the ICU for about 2 to 3 days, in which time he starts his initial recovery. Once he is up and about, which happens on the second or third day, we tend to take out the various drains and arterial lines, etc., from the patient, so that the patient is now ready to come out into the ward. When he does that, he then starts his recovery as if he were at home, but under our supervision. And therefore, once he is fully mobile, able to go to the bathroom on his own, our physiotherapists assess them to do the one flight of stairs. Once they are able to go up and down one flight of stairs, we think that they are ready to go home. By this time, usually the superficial part of the wounds have healed quite nicely, and therefore they are good to go home and after a few days take a bath. An important part about recovery is taking care of the patient's diet and nutrition. Diet means basically to avoid getting the blood sugar and the cholesterol levels high without making the patient starve. At the same time, we have to make sure that the patient gets enough proteins so that his wound healing is not hindered. So it's quite a challenge sometimes to balance the patient's likes and dislikes and what he actually should have. We tend to avoid fried and fatty foods and ask them to eat things like egg white, or eat fresh cut uncooked salads without oil or garnishing, and make sure that they eat fruits rather than drink fruit juices, because the fruit by itself can add to the fiber content of your gut and help in moving your bowels. One important aspect in the whole treatment plan is taking care of the patient's emotional needs. Initially, when the patient finds out that they have advanced disease which needs surgery, it's a bit of a shock, and it takes time for them to come to terms with this fact. At that period in time, it is very essential that they are given positive feedback and inputs which will allay their fears and help them make a decision in the right direction. The reason for having an operation has to be explained in layman terms or easily understood vocabulary. Once the patient has the surgery, there is a lot of anxiety when they experience pain because of the wound, or certain aspects like feeling weak after the operation. That makes them feel that they are not going in the right direction, but it's very essential that the things are explained to them that this is bound to happen. There is bound to be some swelling of the legs, There is bound to be pain when they move. They will be unable to sleep on the sides initially. They have to lie on the backs, which not a lot of people are comfortable with. So in that situation, feedback from medical staff, doctors, etc., the family is very important to make sure that the progress is in the right direction. Because if psychologically, if somebody gets it in their mind that they are not well, then it's very difficult to make sure that they actually progress in the same direction. The other important aspect of the treatment that we must mention is the medicines. Now, initially, before the operation, patients do have to take a lot of medicines, and they feel that after the surgery they will not need to. That is not right. For a few days after the surgery, they might have to take some more, in fact, medicines than they were before the operation. So, initially for 6 weeks, they will be on plenty of them. But at the 6-weekly follow-up, I tend to reduce the medicines and leave only what is essential, which includes your blood thinners, which means an ecosprin, clopidogrel, which also means taking your anti-hypertension medicine, that is your, depends on what you were on before. Thirdly, you have to take anti-cholesterol medication also. So these are your 4 basic medicines that you will be on, and diabetes medicines, which happens to be the case in 75% of the patient undergoing bypass, as they all have diabetes. It's very important to control your diabetes levels, because after the major stress of surgery, blood sugars tend to rise and have to be kept in control so as to prevent wound infection. But once the first month and a half goes by without any infection, then the patient can be switched back to oral medicines, because the high sugar patients generally are left on injections of insulin for the first 6 weeks. Once the sugar levels are back to normal on the oral medication after 6 weeks, then they need to be monitored every 3 months so that the sugars never go high. The reason for this is that having had the operation does not mean you will not have these blocks again. The process due to which you get blocks is still active in your body, and the only way to prevent any further blocks is to slow down that process in such a way that even if there are blocks, they are minor and they never progress enough to cause you a problem in the future. So it's very important to keep your diet, sugar and your medicines regular. Bypass surgery was first done by Ernest Favaloro, who was an Argentine working in the United States. That was carried out in the late 60s, and therefore the bypass operation has progressed quite nicely with a lot of experience accumulated over the last 50 years. Now it has become a very safe procedure, and most of the countries in the world have very competent doctors doing this. The way it is done in the initial days, bypass surgery was done using the heart-lung machine, whereby once the patient was connected to the machine, the heart could be stopped, and the surgery was carried out on a still heart. Initially, only the veins were used from the leg, but then as time went by, it was seen that the internal mammary arteries were very good conduits and actually lasted forever. That is, they were more than 95% patent after 20 years. Now that is very good result. So what we tend to do nowadays is, younger the patient, more chance of using arteries, which can include the radial artery from the arm, from both arms, as well as both internal mammary arteries. And these days, we tend to do beating heart surgery. That means we don't even use the heart-lung machine. Now this has the advantage of preventing complications that the heart-lung machine would cause. which would be like strokes or brain problems or arterial problems, and needed more blood transfusions. Nowadays, because of the beating heart procedure, plus the fact that I personally use cell saver, banked blood transfusion is a rarity. We take the artery or the vein and connect it to the main blood vessel of the body, that is the aorta, proximally, that means higher up, and below we connect it to the coronary artery beyond the block, so that a new channel is created that carries blood and oxygen beyond the blockage. So the heart will not suffer a heart attack, or the patient will not get breathlessness or chest pain as the blood flow to the heart is restored. Bypass surgery was first done by Ernest Favaloro, who was an Argentine working in the United States. That was carried out in the late 60s, and therefore the bypass operation has progressed quite nicely with a lot of experience accumulated over the last 50 years. Now it has become a very safe procedure, and most of the countries in the world have very competent doctors doing this. The way it is done in the initial days, bypass surgery was done using the heart-lung machine, whereby once the patient was connected to the machine, the heart could be stopped, and the surgery was carried out on a still heart. Initially, only the veins were used from the leg, but then as time went by, it was seen that the internal mammary arteries were very good conduits and actually lasted forever. That is, they were more than 95% patent after 20 years. Now that is very good result. So what we tend to do nowadays is younger the patient, more chance of using arteries, which can include the radial artery from the arm, from both arms, as well as both internal mammary arteries. And these days we tend to do beating heart surgery. That means we don't even use the heart-lung machine. Now this has the advantage of preventing complications that the heart-lung machine would cause, which would be like strokes or brain problems or arterial problems, and needed more blood transfusions. Nowadays, because of the beating heart procedure, plus the fact that I personally use cell saver, banked blood transfusion is a rarity. We take the artery or the vein and connect it to the main blood vessel of the body, that is the aorta, proximally, that means higher up, and below we connect it to the coronary artery beyond the block, so that a new channel is created that carries blood and oxygen beyond the blockage. So the heart will not suffer a heart attack, or the patient will not get breathlessness or chest pain as the blood flow to the heart is restored. Preparing a patient for surgery will include getting the patient to mentally accept the fact that he is going to have surgery and be assured that what is being done is going to be in his benefit. Most patients consider these surgeries to be harmful. That is, they feel that once they have had the operation, they will be restricted in a lot of ways physically. It is very important to note that that is not the case. The whole idea of doing this operation is, to me, that your normal lifestyle is not impeded. You have to go back to a normal, if not a better lifestyle, in the view of your activity, your general well-being. The second aspect is the medication. Now there are certain medicines that patients who have blocks are on, that they are called blood thinners or antiplatelet medicines. Now these have to be stopped at least 4 to 5 days before the operation. though in recent times, ecosprin or aspirin need not be stopped before the surgery. The whole idea of stopping these antiplatelets before is to prevent excessive blood loss during the operation. The other thing that we need to check is make sure that the general functioning of the body, that is your gut or your intestines and your kidneys, are working well, because certain diseases like diabetes and high BP can affect the kidney function also, and we need to make sure that that is working properly, otherwise we may end up having to dialyze you afterwards, after the operation. Once that is done, we need to make sure that the chest and your body is shaved properly. There are no skin infections or tags that need to be treated, so that your recovery and wound healing is proper afterwards. During the procedure, patients are under anesthesia. That means that they are fully asleep and do not realize what is happening. This is so that they have minimal discomfort and are pain free during this operation. Initially, the patient is given an anesthetic just after they are wheeled into theatre, and then they fall asleep and then are put on the ventilator, so that even the breathing is done for them by the machine. Once the patient is had the operation done and is shifted to the intensive care unit, gradually they are allowed to wake up, so that at a suitable interval, when they are breathing well on their own, are able to maintain all the parameters without any help, then they can be taken off the ventilator and have the tube removed from their mouth, so that they can talk again, and after a few hours start drinking some water or some juice. Now, as far as the pain control goes, initial 24 hours they have a continuously running infusion of painkiller. That is usually in the form of opioids such as fentanyl or morphine, which keeps the pain levels very acceptable and the patient remains comfortable. In the next period, what happens is that the chest, the type of incisions also determines how much pain the patient has. If the incision is the old-fashioned midline one, which is in the center of the breastbone, then that takes about 6 to 8 weeks for primary healing, and then the complete healing is finished by 3 months. So therefore, the patient will need to wear a belt or a corset around the wound to prevent unnecessary pain due to movement. The other type of incisions that we are using these days are the minimally invasive ones. Now, these incisions mean that cut is very small and it's on the side. It is therefore cosmetically also more acceptable, especially for women, because it goes under their breast and is hidden by the breast. So they find that more acceptable. These wounds are much faster to heal, and the patients go back to a normal lifestyle much faster. That's why this approach is becoming more and more popular.